Great. Thank you, everyone, for having me here today. It's not hard for us to put a face on cancer. It might be yours, it might be your spouse's, it might be a close friend. Cancer affects us all. At GE, with 300,000 coworkers, it affects us all too often. Luckily, we are at GE in a position to actually do something about it. We've been very much involved in fighting cancer for about 50 years now. And through a number of different programs, we have put together a tremendous amount of technology and research that allows us to continue to fight cancer. We have, through a Healthy Imagination initiative, a $6 billion fund that does access programs for rural cancer screening. We have, through our oncology business, spectacular imaging technology that can help speed the diagnosis and detection of cancer. It's through this commitment that we see a tremendous opportunity to engage further with cancer. And to that extent, we've announced last week a $1 billion program that over the next 5 years will be unleashing a tremendous amount of technology in the fight against cancer. We see the end of deadly cancer. We see this as a tremendous opportunity for all of us, and we're trying to marshal all of our different resources to make that happen. But we need your help. We believe in open innovation at GE. We've actually done a tremendous amount of experimentation with it over the last year. We did a great program with energy and invested $134 million in different energy projects, 22 different investments, 1 acquisition. We actually granted to some very early stage entrepreneurs $1.1 million in a quest to build better energy solutions, a smarter grid, better home solutions as well. We think that pattern, that collaboration, that the ideas that we don't have internally at GE can help tackle cancer as well. So we're starting with breast cancer, and we've assembled a $100 million fund in partnership with Kleiner Perkins, Moore Davidow, MPM Capital, and Venrock to invest in early stage and mid stage breast cancer focused companies, specifically tailored around 2 particular paths. Breast cancer pathways, which will map breast cancer pathways independent of classic hormone signaling, and then molecular similarities between tumors. We think that these 2 focus areas are incredibly important and provide a tremendous opportunity to specifically tackle breast cancer in the near term. But of course, we know at GE that you can't have innovation without tapping into data, that there's just too much of a wealth of data that can teach us, that can help the companies in which we're investing get smarter. So to that extent, we're here to announce today a new partnership with O'Reilly, where we're bringing together our data, but then also partner data in a new accessible open platform that's hopefully going to provide a template for best practices in the healthcare research space. We're going to be enlisting the data scientist community to help build this platform with us. We look to your guidance. We look to your participation in this initiative. And we'll be announcing a series of challenges and prizes for data scientists this fall, starting this fall, to improve accessibility and to analyze the data as well. We see this as a great opportunity for all of us to join together and tackle breast cancer. So a couple of quick announcements in terms of the partner data that we'll be including. MQuick, which is actually GE data. It's a de-identified subset of the 18 million lives we track through our EMR, electronic medical record, product called Centricity. We're also partnering with Premier Research Services, de-identified data on roughly 56 million patients. And then also Clarion, which is actually interesting data. It's tracking cancer at the molecular level. We think that this is an interesting and a great starting point for this data. We expect to announce further partnerships over time as we build out this program. There's, of course, an opportunity to learn more. We're going to be having a panel here on Friday with our Chief Privacy Officer, the program leads for data, some of our data partners, and moderated by O'Reilly, to talk about this in depth. We really want the feedback of the participants at the Strata conference over at the Hilton on Friday, and look forward to your input. At data.healthyimagination.com, you can sign up for email announcements for the challenge, and we'll be making those announcements throughout the fall. and then challenge.healthyimagination.com. If you're interested in participating in the overall breast cancer challenge, that's the spot to do it. And of course, you can reply me at JP Marcum. So thank you very much.